Welcome to Pharmative Live, and we're coming to you live from Palm Springs, California. My name is Dr. James Partyka. I'm a clinical pharmacist, oncology research scientist, and the founder of Pharmative.com. Pharmative and Pharmative Live is all about connecting patients to healthcare professionals and scientists in order to improve your healthcare and your family and friends' healthcare. And this is Pharmative Live, and Pharmative is part of the PNN Multimedia Group located right here in Palm Springs, California. And we're sponsored today by our PNN Plus Health mobile app. And you can get your PNN Plus Health mobile app for free by downloading it at your Apple and Android stores today. And what's great about the PNN Plus Health mobile app, you know what the plus means. You know how you hear all these apps that say plus? Well, plus for PNN means health. So not only do you get great music through Pride Nation Radio, we also have 4 other music stations. You get retro TV, retro cartoons, Sky News, classic films, but you also get a number of vital healthcare resource tools, all in the palm of your hand. Okay, information that is vital to taking care of you and your families. For example, we have a doctor symptom checker, which is a chatbot which is brought to you from the UK, which will take your symptoms down, come up with a differential diagnosis of what's wrong with you, and you can discuss that with your healthcare team. We also have a virtual pharmacy where you can look up your medications, check the side effects, check the dosage, and it also has a drug interaction checker. There are a number of other healthcare resource tools located on your PNN Plus Health mobile app, and I encourage you to download your app today. I received a question this week from Steve in California, and his question reads, what can we do about the treatment of COVID-19? Now, that's a loaded question, so I'm going to start off by talking about first prevention, followed by early treatment, and then late treatment of COVID-19. And I also want to remind all of you that you can send your questions, or you can text right now to info@pharmative.com. So send your questions to info@pharmative.com for next week's forum, or text me now live as we're streaming live from Palm Springs, California. Let's first talk about prevention. We all know about masking up, social distancing, washing our hands, avoiding large crowds and large events. That's all about preventing the spread of COVID-19 disease in our communities. Okay. Now we also have, as we have discussed in previous Pharmative live topics, previous events that you can download at Pharmative YouTube or go to Pharmative.com. But we also have 3 very safe and efficacious vaccines. We have one from Moderna, which is 2 shots. We have one from Pfizer, which is also 2 shots. And then we have the Johnson & Johnson vaccine, which is 1 shot. Those vaccines are available throughout the United States. And when it's your turn, you want to make an appointment and you want to get vaccinated. The vaccines basically do not cause COVID-19. The vaccines basically produce antibodies from your own immune system that are targeted towards the spike protein located on the COVID virus. And that stops the virus from spreading into your organs and tissues. Very effective vaccines. You should get vaccinated as soon as your turn is called for, and you can learn that from your local public health state officials as well as your local news, and you can get vaccinated at local pharmacies throughout the country. There are specialized large massive vaccination sites also throughout the country, as well as clinics. So get vaccinated. That prevents you from getting COVID-19, and we know that these drugs are highly efficacious and very safe. So get vaccinated. So that's prevention. Okay, now in this week's feature article in our online magazine, PrideNation.com, we tell the story of Bob and Joyce. Bob and Joyce were both elderly, over the age of 65. Bob was not feeling well. He felt like he was getting a winter cold. Joyce was at home and feeling feverish with chills and headaches. Both Bob and Joyce had access to the Mayo Clinic. And within 4 hours, the Mayo Clinic was able to determine that they were COVID-19 positive. So this is what you do if you have a positive test. Immediately you self-quarantine to minimize the spread of disease to other people, which they did. The Mayo Clinic was equipped to send them with a COVID-19 health kit, which included a blood pressure cuff, a thermometer, a weight scale, and a pulse oximeter. Now, some of you out there may not know what a pulse oximeter is, but essentially it's a very sensitive device placed on your index finger that measures your oxygen level. Now, typically your oxygen level should be 95 or greater, although your baseline may be slightly below 95. If that pulse oximeter measures your oxygen level to significantly drop, that's an indicator that you need to go to the hospital. Definitely call your doctor and talk about whether you need to go to the hospital. All right. So Bob and Joyce from the Mayo Clinic did just that. They measured their vital signs at home, and they either called their doctor or they entered it into the computer, and the Mayo Clinic was able to monitor them remotely. Now, Bob's symptoms started to progress slightly from mild to moderate. Joyce worsened, and her symptoms became systemic body pain, and at times the pain was so severe she was crying. The Mayo Clinic determined that they were candidate for monoclonal antibody infusions. Okay, this is early treatment. And essentially the criteria that they determined that both Bob and Joyce were at high risk of developing moderate and severe COVID-19 disease, which would require hospitalization. Those high-risk criteria are age greater than or equal to 65, body mass index greater than or equal to 35, chronic kidney disease, diabetes, immunocompromised patients such as a cancer patient or a patient with an autoimmune disorder, those patients with chronic respiratory disease that are 55 years of age or older, and cardiovascular disease, age 55 or older, are the risk categories, which allow, if you have any one of those criteria and you're developing symptoms of COVID-19, makes you a candidate for receiving these monoclonal antibodies. Now, what is a monoclonal antibody? Hi, Jimmy out there. Hi, Alan out there. Hi, Helen out there, and Joyce. Welcome to Pharmative Live. We're now talking about the early treatment of COVID-19. This couple, Bob and Joyce, had symptoms of COVID-19, tested positive COVID-19, were told to self-quarantine. Mayo Clinic sent them a monitoring kit for COVID-19, which included a blood pressure cuff, a weight scale, and a pulse oximeter. The pulse oximeter was to measure their oxygen level at home. They were also given a weight scale, and they were entering their vital signs 2 to 4 times a day into a computer, or they were calling them in directly to the Mayo Clinic. The Mayo Clinic, by the risk categories I just listed for you, determined that they were candidates for monoclonal antibodies. Now, what is a monoclonal antibody? It's basically an engineered antibody that's manufactured in a laboratory. Mono meaning one, which means that antibody is targeting one particular site on the virus. In this case, it's targeting that spike protein. And when those antibodies target that spike protein, it generates other immunologic cells to stop the virus from spreading into your tissues and organs. So it basically jumpstarts your ability to fight that and crush that COVID-19. That's what monoclonal antibodies are for COVID-19. And there's two major companies in the United States that have what you will refer to in the lay press as cocktails, because they combine more than one monoclonal antibody. And those companies are Eli Lilly and Regeneron. So if you're developing mild to moderate severe symptoms and you have one of those criteria for high risk, you need to ask your doctor, are you a candidate for monoclonal antibodies or for a cocktail of antibodies against COVID-19? They're given in infusion centers throughout the country. They are available and FDA approved for national emergency usage, okay? And both Joyce and Bob received their monoclonal antibody infusion in the clinic. And within hours, Joyce was starting to feel much better. Bob was feeling better immediately. And within 10 days, they were back to feeling almost normal. So these antibodies are very effective. The side effect is infusion-related reactions, possibly a very low incidence of anaphylactic reaction. So when you're in the infusion center, you get a 1-hour infusion of these monoclonal antibodies, referred to as cocktails of antibodies because it's 2 antibodies in one infusion. There is also a product on the market with just one monoclonal antibody. You get these through an infusion center at a clinic. Oftentimes, these may be at cancer centers or big institutions, big hospitals that have these antibodies available to them through a national emergency use approval through the FDA. And within hours, they were feeling better, and within 10 days, they were back to normal. That is early treatment of COVID-19, and I want you to take charge of the fact that if you have serious symptoms and one of those criteria, or early symptoms and one of those criteria, you want to ask your doctor and clinic about getting a monoclonal antibody infusion. Unfortunately, in this country, they're not being utilized to the extent they can. And what they do is prevent the disease from progressing to moderate to severe disease, prevent you from going into the hospital. All right, so they work. They have very little side effects associated with them. Okay, you do not want to get moderate to severe COVID-19 and be hospitalized. The only therapies that we have now available for moderate to severe disease is hospitalization, oxygenation therapy, intubation. We have a steroid, dexamethasone, that's been around for decades, which reduces inflammation in the lungs. Again, it's been used for many other indications for decades. It's not a breakthrough therapy. It's a corticosteroid that's been used to decrease inflammation for other reasons as well. And then we have one IV antiviral therapy called remdesivir, which has not been proven to be that effective. It's only been shown to reduce hospitalization days and not demonstrated to reduce mortality. That's the only therapy we have now for moderate to severe disease. So we certainly need more antiviral therapies. And I can envision in the future, because research is ongoing right now, that hopefully we'll have oral antiviral agents against COVID-19. So if a person is symptomatic, tests positive for COVID-19, they're prescribed an oral antiviral agent from their pharmacy where they're dispensed. They start taking that immediately to prevent the progression of COVID-19 to moderate to severe disease. So anyways, that's all I have today. And the take-home message is, if you're COVID-19 positive, You want to self-quarantine. You want to see if you're a candidate for receiving monoclonal antibody infusions, known as the cocktail. They're available through Regeneron and Eli Lilly, and there are other companies developing monoclonal antibodies as well. It's a way of providing a jump start by providing passive immunity. The antibodies are actually infused into you that target the spike protein on COVID-19. Just like a vaccine works, a vaccine just doesn't work as fast. A vaccine basically stimulates your immune system for your own body to produce these antibodies so that when you're exposed to COVID-19, your immune system is armed and ready with a jump start to crush COVID-19. That's all we have today for Pharmative Live. In the meantime, stay healthy, as it's easier to prevent disease than it is to treat human disease. I'll see you next time. My name is Dr. James Partyka, and this is Pharmative Live.